more dedicated and better trained doctors and nurses. We have also improved efficiency, and the confidence in the health system here will improve. But as I said before, the attitude to patients is a very critical factor. A lot of people who have the money do feel that they are not treated respectfully or treated with dignity when they go to our health institutions. So they prefer to go abroad where they enjoy. It's not that they don't feel that they can be treated, but they feel that they're not given the dignity, and probably there's a mindset among healthcare givers here that the patient is inferior. In reality, the patient is a superior person in a hospital. So that attitude actually has to be corrected. And if all this is in place, I believe that we shall be able to achieve more for what we get as an allocation to health. Now, Senator Watuga, with respect to doctors in private practice, this is a problem that has been on in this country for so long. And it is true that a lot of doctors, or nearly every doctor, thinks he also should run a private hospital. But quite clearly, it is unethical to divert patients from a hospital where you are receiving salaries to another place where you also charge the patient. That is clearly unethical. And there needs to be a new approach, a conversation with doctors generally to reach a situation where an undertaking will be signed to work out where the boundaries are, where your responsibilities are, and where your, if you have extra services to render, well, the hospital could pay you extra instead of you going to open a private hospital while you are in government employment. There is need to find innovative solution to that in working out a proper healthcare policy. I believe that's all.
Dear to my heart. I would like to ask a few questions. One is that I was privileged to build the biggest hospital, world class, in West Africa.
And he could not go to that hospital. He could not go to that hospital for treatment.
Order.
Chief, well done for that intervention. I was privileged to build the biggest hospital in West Africa. And as I speak now, we
didn't go there for treatment.
We are trying to populate it with skilled manpower. Most of them are actually Nigerians like you, who are returning from various countries abroad. The intention here is to ensure that we reduce capital flight to India. And I would like to ask you if you will lend support to states who make such investments, so that at the end of the day, the aggregate outcome will be that Nigeria collectively will have reduced capital flights outside this country. That's one. The challenge we have now is on the Medical and Dental Council of Nigeria, who are insisting that most of them must pass through rigorous tests and be accredited to work in Nigeria and all that, outside immigration, but we are surmounting that. The next question I would like to ask you is something that happened here in Chambers. About a week ago, there was a motion here that a lot of children are suffering. They graduate from medical colleges and they cannot do house manship. And the result is that after 2 or 3 years, they begin to forget even some of the things they learned in medical colleges. So, and we are looking at a possibility of a national policy that can ensure that once a child graduates in medicine, that child automatically goes to do house manship, so that that child can eventually become a full-fledged doctor. So I would like to ask you, because in your time, that is what was happening when you graduated. So I would like to ask you, if you are given the portfolio of Minister of Health, will you encourage this We do set up a national agency to ensure that all medical colleges in Nigeria are, aggregated in a way that will enable every child that graduates in medicine to have automatic house officer's jobs, so that we can increase the medical density or the doctor density in the country. The other one I would like, of course, the other one I would like to also ask you is, what are you going to do about this traditional birth attendance? Because so many people lose their lives as a result of traditional birth attendance. They are also offering services, they help, but by practice as a governor, we found out that many people, maybe out of lack of money, patronize them, many pregnant women, and then we record a lot of deaths through traditional birth attendance. Are you going to train them and then make them part of the health system if you are given the opportunity to be the health minister? And then finally, I would like to also mention the issue of just the little statistics, that most of the successful surgeries in Nigeria, at least 45% of deaths that occur from successful surgeries in Nigeria occur through post-surgery management. The surgeon finishes his job and it is successful, and then the management results in the patient dying because infection comes in, this comes in. So what are you going to do to improve the skill of our nurses and train those who are engaged in post-surgery management, so that we can reduce the number of deaths associated with what I may call successful surgeries in the medical institution? And I want to commend Mr. President for fishing you out, because you have the right qualifications, the right integrity to serve this country. So I congratulate you in advance.
Mr. President, distinguished colleagues, I want to crave your indulgence again to remind our colleagues that we still have to take 5 nominees on our roll. So please let us be precise and not be repetitive in our questions. And having said that, I want somebody to second that the nominee do take a bow after answering this.
After answering, a seconder.
Senator Bacha.
Mr. President, given the performance of the nominee, I rise to second the motion that the nominee take a bow.
After answering questions before.
Yeah, after answering briefly those questions at least.
Yes. Okay, Dr. Osagie, you have a few questions before.
Thank you very much, distinguished Senator, for the compliment. Distinguished Senator Akpabio, for the compliment, and also for the hospital that you have built. I will be very interested in looking at it. Now, the issue of housemanship, yes, that is a pertinent question, and I believe that it can be taken care of if a proper program is worked out to be able to accommodate all medical graduates. Problems can be solved if you sit down and look for answers. So that should be workable. The issue of traditional birth attendance, I said a while ago that before Orthodox medicine came, traditional medicine and traditional birth attendants were all we had. But now that there is Orthodox medicine, it does not mean that traditional birth attendants and traditional healers are out of job. But I believe that this area should be better organized and better supervised. There is almost no supervision right now. There is nobody who can tell how good a traditional healer is. So we have been involved in, I'm a trustee of the T.Y. Danjuma Foundation, which does programs to retrain traditional birth attendants and also do medical missions. So there's a lot of emphasis in trying to integrate traditional healers and traditional birth attendants into the mainstream health sector. and that should reduce the amount of dangers that come from that side, because at the moment it looks unregulated. With post-op mortality, again, it comes down to training and management and organization. All these ones need to be reviewed, they need to be improved, they need to be reset. We're not using the facilities we have at the moment to the most optimal level. So that one needs to be reorganized, and of course we need more equipment, better training, more in-service training, and more refresher courses to be able to improve the quality of healthcare providers that we have here.
Distinguished colleagues, the wish of the nominee takes a bow and go.
Yes.
Well, there we have it, the nominee taking a bow and about to leave the chamber. He's also had close to 50 minutes. He's had, this is going to be the second most longest, we say, screening process thus far among the 5 nominees so far seen by the Senate. And I'm sure you got the slight reminder there from the majority leader where he reminded members they need to keep their questions short. They also need to not repeat themselves so as to ensure that the nominees are screened, and the 10 nominees that are lined up for today are seen by the Senate.